HEALTHCAREONOMICS, changing healthcare by changing the way you think about healthcare. Why can't I find the prices for healthcare? It's no secret that health insurance deductibles have been rising for the past several years. What has remained secret, however, are the prices for healthcare. Prices that, thanks to deductibles that are now in the thousands of dollars, many Americans are being forced to pay. But ask your doctor or your hospital how much they charge for an aspirin or an appendectomy, and the chances are they won't be able, much less willing, to tell you. But why? Why is it so hard to find out how much healthcare costs? Because of health insurance. See, throughout the latter half of the 20th century, health insurance wasn't really insurance. Instead, with its extremely low copays and deductibles, health insurance acted more like prepaid health care. So it worked a lot like a protection racket. Just pay me a monthly premium and
I take care of everything.
While this may have seemed like a fantastic idea at the time, having such good health insurance that shielded people from paying for what they were buying also shielded them from the prices of what they were buying. But the good old days of $5 copays and $200 deductibles are long gone. And as patients now find themselves as consumers, they naturally want to get the best deal. Instead, they are finding themselves frustrated at what is called a lack of price transparency in healthcare. Or you could say that patients don't like not knowing how much they're going to be charged. I mean, not many folks would go to a restaurant whose menu had no prices on it. So why should they put up with that kind of behavior when it comes to something as expensive as healthcare? It isn't just patients who are riled up either. Price transparency is now making the news and has become all the rage in politics.
We should give power to the patient, the power of price transparency.
Plenty of lawmakers are seeing an opportunity to appeal to the masses by crafting legislation that, they claim, will result in healthcare prices being posted for everything, from bandages to operations. But no matter what laws Congress may pass, price transparency does not, will not, and cannot exist in much of America's healthcare system today, for one simple reason: managed care contracts. Actually, these arrangements where health insurance companies act as third-party payers, they're not so simple at all, because they complicate healthcare pricing beyond belief. How? Traditionally, when we make a purchase, there is a single price attached, and the same price applies for everyone. Not so in healthcare, where one product or service can have several different prices for several different patients at the same time. To see why, let's take a look at what Dr. Smith charges for a 15-minute office visit. If Dr. Smith is in-network with 6 different health insurance plans, then that means she has signed a managed care contract with each of them. And since each of those insurers has negotiated a different price for themselves, then that means that Dr. Smith now has 6 different charges for the same 15-minute office visit. See how the pricing for something as simple as a trip to the doctor can get very complicated very quickly? But wait, there's one more price we have to consider, and it's called the charge master. The charge master represents the starting point for negotiating prices with health insurance companies, and as such, it is the highest charge for a particular product or service offered by a healthcare provider, like a doctor's office visit. But the charge master price is an amount that almost never gets paid.
20 shekels. Right. What? They what? Wait a minute. Well, we're supposed to haggle.
Think of it this way. If you want to sell your house for $100,000, you wouldn't list it for sale at $100,000. Instead, you would ask for something higher, say $125,000, in the hope that you and a buyer can reach an agreement where you get what you wanted for your house in the first place, $100,000. This same principle applies to the charge master in healthcare, except in healthcare, the asking price is typically outrageously inflated, like $12 ibuprofen tablets that patients can find on their hospital bill. And in the case of what she charges for an office visit, let's pretend that Dr. Smith has set her charge master price at $500. That's a lot of money for 15 minutes of Dr. Smith's time. And thanks to their ability to haggle, it isn't nearly what those 6 different health insurance companies will pay her for a visit. $500 isn't what the average patient is willing to pay for a sit-down with Dr. Smith either. And so advertising this, and a list of her other exorbitant charge master prices, to the public would probably be a death knell for Dr. Smith's medical practice. So why can't the good doctor just post a more reasonable price for an office visit, say $75, for those patients who want to pay her directly instead of using their health insurance. Because doing so would undermine the $500 that Dr. Smith has set as her chargemaster price, and would set the negotiating bar much, much lower for when it comes time to renew her contracts with the health insurers. And therein lies the problem. It is the way that healthcare prices are established in the first place that prevents any kind of price transparency. Because physicians, hospitals, and other healthcare providers who participate in health insurance networks are caught in a catch-22 when it comes to advertising their prices to the public. They can either put up a menu with their outrageous chargemaster prices listed, or they can offer steep discounts to those paying directly, which will jeopardize their ability to bargain with health insurers the next time they have to. And so legislators may legislate all they want to.
Well, good luck with that.
But no new laws will ever bring about price transparency in most of our healthcare system. Instead, the only way this will ever happen is if healthcare providers stop participating in health insurance networks and stop signing managed care contracts. It makes sense for them to anyway, since the average health insurance deductible is now over $2,000, which means that most privately insured Americans have to, sooner or later, end up paying for their care. And just in case you were wondering, yes, healthcare can be, and in fact is, a whole lot less expensive when health insurance isn't involved. And I'll show you how in my next video. Until then, for HealthCareOnomics, I'm Dr. Kevin Wacasey.